Idiopathic pulmonary fibrosis is one of the most common diseases inside of the interstitial lung disease. Idiopathic pulmonary fibrosis, it means that is a disease, isn't a scarring. The lung is developing scarring that replace the usual lung tissue. And the problem is that we don't know the etiology. It's for this reason we call idiopathic. But we have done a study during the 10 years that we can publish in Lancet Respiratory Disease. And we have done a very comprehensive study making all the tests necessary for diagnosis. And we have found that at least 42% of people with idiopathic pulmonary fibrosis, in reality, they are hypersensitivity pneumonitis. One's due to contact with birds, one contact with either down or pillow, feather pillow, or others. No? So it is important when a physician study a patient with idiopathic pulmonary fibrosis to do all the tests necessary to look for another disease, let's say hypersensitivity pneumonitis, or even tobacco smoke. I believe that is also another cause of pulmonary fibrosis. No? So we do a very comprehensive clinical history of the patients, no? Very comprehensive. Look for all the conditions that can do hypersensitivity pneumonitis. We do IgG, specific IgG, an antibody against fungus or against birds or against feathers. And we do bronchoalveolar lavage, it means a bronchofibroscopy with bronchoalveolar lavage to see if they are lymphocytes, for example. And also, when we believe that the etiology is known, we try to do it an inhalation test. No? So if we do all these tests, you arrive to diagnosis at least in 50%, but in my opinion, probably 70% of idiopathic pulmonary fibrosis are consecutive to hypersensitivity pneumonitis. No? So if you don't do these tests, these tests are not very in many centers they doesn't do these tests. So the patient is labeled as idiopathic pulmonary fibrosis. So if you don't do this test, afterwards you have to do much more surgical lung biopsy. At surgical lung biopsy, you have some problems with surgical lung biopsy. So it's better to do all the tests we have explained here. No? Well, once you have the diagnosis, you must do the treatment. IPF is a serious disease, no? So, and now, during the past 10 or 15 years, we have contributed with many doctors in the world to discover that some two drugs are effective now. No? One is pirfenidone, and another one is nintedanib. These are, well, somehow effective. We need much more drugs and better drugs to improve the patient, but well, we have this one. And in my opinion, and I know that a Cochrane revision say that you don't have to give corticosteroids to IPF, to idiopathic pulmonary fibrosis, but if now we have shown that many of these patients are in reality hypersensitivity pneumonitis, you have to do a corticosteroid. So in my practice, I try to do antifibrotic, but also corticosteroids.